colds that turn into sinus infections are just misery. I have experience with that. You have experience with that. I think the world around us, it's a pretty common theme. Meaning that, like, we're, this time of year where school has just started is brutal for many folks, and they don't even necessarily. So that there is a truth there, meaning that you absolutely are exposed to more cold viruses and those things when everybody's together and
in the herd,
in close contact in the herd. When the herd's together, you're going to pass things around to the herd.
Right.
And so, and kids, whether it's daycare or schools, and the teachers in the schools, it's fertile grounds to get things passed through. So I personally I have 3 children, and they're older now than they used to be, but I'd say now I'm not scared of my children's colds versus about, boy, when my kids first started in school, it was like, stay away from me with your cold, because every cold, back before I had, my procedures done, every single cold would turn into a sinus infection. And then I remember trying to think, late 2000s, like 2006, 7, 8, 9 kind of a thing. It was like from start of school all the way to the next summer, constant, stuffy, headachy, plugged up, dealing with it. And it's just like, and that didn't happen back before I had kids. That wasn't the case. I mean, I was annoyed with the congestion, but it wasn't the sinus infection thing. And that had added a whole new reality to insult to injury. So.
Yeah, it's like summertime's just enough time to forget what that feels like, and then within that first week of school, and then your kids come home and it's runny noses, and you're like,
here it comes.
This is going to be a problem, And so, my experience wasn't as bad as yours from a time standpoint. Like for me, really, it was like once my kids got in school, I was able to understand what was going on and attack it by pulling you in that room and having you do procedures in my nose. But, for me, because people ask, like, why did I have that done and what's the tipping point? Everybody wants to know, like, why did things change like 2 years ago? And everybody's got some tipping point that makes their nose worse than it had been prior. And for me, it was kids in school. And then it's awful. Like, it's awful just feeling crummy and facial pressure and pain and just drainage, and you can feel it going back. And it's about being able to blow your nose, get stuff out, clear that cold efficiently so that it doesn't turn into the sinus infection. I feel like for us, if our patients come in and they're like, hey, I can blow my nose and I'm getting a bunch of crap out, great, good sign.
Yeah.
Right?
Although, and I don't think a lot of people understand this, the concept is, as far as, what even a sinus infection is. I mean, because the sinus infection, basically, sinuses are the air pockets in your skull, they all drain in the nose. If things are working properly, all good. If the sinus openings shut down on you, then all of a sudden everything backs up, and then you can get a sinus infection. So for me personally, it was, my anatomy was challenged. I've broken my nose a few times and that sort of thing. And so I didn't deal with sinus infections, but my anatomy was tight. And so all of a sudden onto that tight anatomy, you throw frequent colds of all sorts of different varieties, and that inflammation takes what was tight and shuts it down. Once that shuts down, then you're stuck, and now you're treading water just trying to get out of trouble. Right. And so if things are moving, not always, but basically if you have a choice, well, certainly always, if you have a choice between open anatomy and closed anatomy in your nose and your sinuses, open is better than closed every day of the week.
100%.
Most people don't understand that they have a choice. I think that's the reality with what we do here, is that there is a choice. And because there's a choice, it doesn't mean you need to choose to do something. But by not doing something, if you know that there's a choice and you choose not to do something, then you're making an active choice. Period.
Yep.
And so for those that kind of follow the ball there, that if you're running into frequent trouble or constant trouble, then there's something wrong with your anatomy in this situation. And the nice thing nowadays is there's a spectrum of options from do nothing, keep dealing with it. Meds, if you've got an anatomy issue, medications aren't going to help you, really. It's just that's the deal.
Yeah, people have been through the pharmacy aisle and dealing with that,
right?
And like
it's sort of because what meds can't open the anatomy. Meds can help to treat the lining, maybe at their best, and so then it's like, well, you could do nothing. You could play around with some medications, and have fun with that. Now, and then it used to be, well, or you could go to surgery, and surgery is still absolutely appropriate, but now we've got that in-between step or, sort of alternate pathway of office-based procedures, which conceptually is just taking those areas that are shut and opening them up with, simple things we can do here in the office. And so for a lot of folks, that's open the door, like literally open the doors for those sinuses, to open the door to say, yeah, this current existence is not not what it needs to be. Maybe I'm not too keen on surgery, but doing an office procedure, if it's going to help me, worth the shot. And it often, well, almost, not, nothing's 100%, but it's pretty remarkable on how helpful that stuff can be.
And we live in this whole quality of life kind of realm in the sense that, like, hey, if somebody had 10 sinus infections 1 year and we got it to 5 or 2 or 3, for them that might be a massive win for them, know, and it is, I mean, we can't get rid of sinus infections forever and ever for every patient always. That's just not reality. But I think the point is that people have decisions that they can make, and hey, if we step things up the ladder and they come in for an office-based procedure and to them it feels like it's dramatically better and they're happy, that's a win.
Yeah. Absolutely.
And so not necessarily have to go to the operating room, and it's still something we can always do when we feel comfortable doing it. It's just, you're right, most people, hey, I want to make some improvement, I don't want to be down for a week, and so that's where it's a nice middle ground.
Yeah, and it can take, I mean, again, everybody's different, everybody's anatomy is different, everybody's situation is different, but it's for those that are like fighting that fight, I mean, some folks it just never ends, and other folks it's certain times of the year, but if you're fighting those fights, that, there's not there's some possible solutions to that. I guess is the bottom line.
And it makes treating the lining easier, right? So that's where it's hey, can we get people off this combination of, their Sudafed, their Claritin, maybe the Benadryl at night, like combo pill, which, from my standpoint, it's always like, well, what are the systemic side effects you're getting from all those pills, right? So can we get you off that, get your nose open, use sprays directly where it matters, right here, keep things local, and mellow things out that way, because now you're more open, sprays can get in, they'll work better for you, and then maybe it's just a seasonal thing that you need to be on those sprays.
Yeah. No, and I think that's another topic, if we can, another topic that I think is worth talking about is this difference in opinion as far as medications versus procedures, like, what's better, what's not better, and the reality that every person, every individual, every physician has a different viewpoint on that. And I don't think people understand that reality, that when you're seeing a physician, so we're ENT docs, otolaryngologists, wonderful, wonderful for us, which is great, but our viewpoint is distinct and different, just like everybody has a different political opinion, whatever you want to call it, but or you pick a subject, everyone's going to have a different opinion. It's sort of assumed in the outside world that, oh, I'm going to go see an ENT, and therefore you're going to get the exact same thing off the menu that you're going to get every other, it's like you're at McDonald's, you can get a Big Mac, and a Big Mac's a Big Mac, it's a commodity. Yeah. Wonderful, and a Big Mac's fine if that's what you're looking for. But the truth is that when you're seeking out medical care and you're seeking out an individual, you're seeking out an individual's opinion. And my personal opinion, which weighs heavy around here, is my personal opinion is if I have a choice between doing something if doing something active to make me feel better and minimize my use of medications versus don't do that thing and use medications. For me, in my body, I want to use the minimal amount of medications possible. Like I want to be, I take nothing. I don't take any medications. Now, if I have to do that, like if I have no choice and that's what I've got to do, fine. But if I have a choice between something procedurally that may alleviate my need for medications versus Band-Aid after Band-Aid, medication after medication, every day of the week, I'm going to do that. And I don't know how you feel. I know how you feel about it, but I'd say, and maybe we're anomalies. Like maybe we're the weirdos here. But I'd say I don't think so. I think we have a lot of people come to see us because they're weird just like us.
Well, I wouldn't even say it's that. It's because people are sick and tired of taking all those pills and medications, right? Because people.
Well, especially that's why they land and they don't work. I mean, I guess the other truth is, and they don't work. I think if you're taking something that's working and you have a choice to not take it, okay, well, maybe you might mull that over. You've taken something that's not helping you,
Right.
and you have a choice to do something that might actually help you, then that's a whole
Well, or
different ballgame.
their sense of what's helping them, they feel like maybe they're a little better or not, but it's not like this profound change for them. And I think that that's what's frustrating for people that come here, is they've seen a lot of times all these other physicians, and like you said, we all have opinions based on science, hopefully, but like there's different ways you can interpret what that means, and there's no direct way. You don't have to go from doing nothing to medication management to procedures to the next, although a lot of people say that that's the route you have to take, but a lot of people have tried these medications, aren't feeling like it's helping them. Find us because, hey, trying something that's going to help them is better than doing nothing.
Sure.
And it's not inexpensive to keep buying all of these pills.
Right.
Like, it's just
Correct.
not.
Yeah, absolutely.
And so if insurance can help them feel better dramatically, and then they don't have to take all those pills, that's a win for everybody.
Yeah. Yeah, which is, and I think, again, unfortunately, that's, so the reality with what we do, like in the nose and the throat and those areas, the science is not settled. I mean, for science, if anybody ever says, oh, the science is settled, that this is what it is, they're obviously not scientists.
Run the other way.
I mean, that's like,
Yes.
there's no, like, and it's a challenge because you tend to hear sort of this groupthink mentality, which is sort of was forged in a different era. Like nose and sinus issues in particular, the typical treatment pattern that most ENTs follow and the medical community follows was adopted prior, that's adopted, decades ago.
It was adopted when it was more dangerous and scary to do these
To do
procedures,
anything.
and it was more invasive.
Absolutely.
And so, yes, you would use that as a last resort because the risks and complications were higher, and so.
And that
that's
wasn't, I mean, it was, and so that's still the mentality. I mean, and medicine's slow to change, and I'd say, if something new pops on the playing field, it doesn't make it great, but I'd say if something new pops up in the playing field that allows us to do something we couldn't previously do, that to me, and generally our opinion is, well, then forget everything else, forget the old world. Let's think about how this might impact our new reality, and let's see where that goes. And it's not and that's not for everybody. I'd say, like, obviously it's not for everybody because what we do here is distinct than what is done elsewhere, because we have that mentality. I mean, I think part of it, sometimes I think people wonder, like, what are these guys doing? Why is that? Like, what is this versus what's happening, elsewhere? Maybe they don't wonder that. I do. Sometimes I don't concern myself with so much what's happening elsewhere. It's more a matter of, what's in our control. And absolutely, I mean, if there's things that make sense that can help somebody that we can offer and do, then it's our job to let folks know that those things are out there.
Yeah.
It's pretty simple.
And I think coming back to kind of like so cold flu season, so, flu shots, okay, so para-influenza, that's the flu. It is an upper respiratory tract issue. Fortunately, like if you get the flu shot, it does decrease your chances of getting that, and that can be pretty dangerous, and for kids and adults even. And so worthwhile getting. That being said, probably more likely what you get throughout the year is like a common cold, right, which is a virus also. But, where we play a role in that is again, helping people get through those periods more easily.
Sure.
Where it's not as debilitating, they can still take their kids to school, they can still go to work, feel productive, maybe deal with it, but it'd be a lot less of an issue for them, and maybe people who are sick won't have to be on as many rounds of antibiotics and things like that, right, throughout that season.
Right.
Which honestly runs all through winter and then like the summer, and then you get hit by allergies.
Right.
So,
well, it's similar thing. I mean, meaning that like what we're doing, most of our procedures are taking things that are tight and making them more open.
Right.
Anatomy that's more open is both easier to roll with the punches. You have more wiggle room. So if you're more open, you can deal with a little bit of swelling that a cold's going to give you or allergy is going to give you, and it may not shut you down. That's a good thing. In addition, the more that things are open, the easier it is for us to deliver medications if necessary into the nose.
Right.
So it's not. This isn't like. This is second grade logic, but second grade logic for some reason escapes the medical community often. It's that simple. And
Right.
so if you could do something to, if you can be more open in those areas, you will be more bulletproof when you're out in the world. And the more shut down you are in those areas, the more fragile you are. And it's like, well, same thing. It's not necessarily a stark choice, but oftentimes it is. You can choose to be, sort of solid, bulletproof, or you can choose to remain fragile. And
Yeah.
that's a choice. And I mean, it's not to me to decide what's the right thing for you, but it's for us to decide to let people know that those choices are, deserve to be known and deserve to be made.